Did you know that post-operative pulmonary complications affect as many as 1 in 3 surgical patients? These figures vary depending on definitions, patient demographics, and types of surgery. Under general anesthesia, the supine position leads to uneven lung mechanics, with the ventral regions prone to overdistension and the dorsal regions experiencing cyclic opening and closing of the alveoli. Muscle relaxants cause diaphragmatic atony, leading to cephalad displacement of the diaphragm and abdominal viscera. This restricts lung expansion and increases intra-abdominal pressure. Simultaneously, relaxed intercostal muscles cause the chest wall to retract and the chest diameter to narrow. Collectively, these changes reduce functional residual capacity, decrease respiratory system compliance, and elevate airway pressure. In certain patient populations, such as those with obesity, where excess adipose tissue exerts additional pressure on the diaphragm and chest, or those with pre-existing lung disease or compromised lung tissue, these physiological changes become even more pronounced. In such groups, clinical outcomes may worsen further. When you add surgical factors such as capnoperitoneum or the Trendelenburg position, often seen in laparoscopic and robotic-assisted procedures, the situation becomes even more complex. These conditions further reduce functional residual capacity and respiratory compliance, while increasing airway pressure, making patients particularly susceptible to atelectasis in dependent lung regions. In these scenarios, traditional ventilation strategies may fall short. Instead, an individualized, lung-protective ventilation approach should be considered, tailored to each patient's specific lung dynamics. Given the heterogeneous lung mechanics in these situations, finding the optimal PEEP can be especially challenging. But what if you could see, in the moment, what is happening inside the lungs? Imagine visualizing, in real time, how air is distributed throughout your patient's lungs, right at the patient's side in the operating theatre. This is where Dräger's PulmoVista 500, an electrical impedance tomography solution, comes into play. PulmoVista 500 provides real-time imaging of both the morphological and functional heterogeneity of your patient's lungs, enabling you to individualize ventilation settings. Its diagnostic view automatically detects recruitment maneuvers and displays decremental PEEP trials, helping you quantify overdistension, cyclic opening and closing, or collapse, and determine the best PEEP for each patient. Combining PulmoVista 500 with Dräger anesthesia machines unlocks even greater potential in patient care. The automated lung recruitment tool of the anesthesia machine streamlines recruitment maneuvers, while PulmoVista's real-time imaging instantly shows how the lungs respond. Together, they help you quickly identify who benefits from recruitment and which individual ventilation settings are needed for every patient. With Dräger's advanced peri-operative care solutions, incorporating precise ventilation technology and real-time ventilation monitoring, you can individualize intraoperative ventilation and achieve better outcomes for your patients simply through smarter care. Making ventilation visible with PulmoVista 500.